I'm going to come chat with you this afternoon. After I get out of the thing, I'm going to come chat with you. Imagine your worst day ever, and then imagine reliving that every single day. Here, I've attended funerals almost monthly. Did you have some lunch yet? Did you eat something yet today? My name is Chanel Twan. I work at Boyle Street Community Services Centre in Streetworks. We're going to give Miss Deandra has a skin tattoo removal appointment tomorrow. A day in the life of an outreach worker. It could be a variety of things. It might be that I'm doing community cleanup and doing a needle pickup and cleaning up debris from the streets and walking around the neighborhood, connecting with folks. Or it might be that I'm at the hospital another day connecting with folks who maybe don't have the resources and supports in place. The impact that this fentanyl poisoning crisis has had on our community has been significant. It's been immense. It's been very destructive.
The current crisis or catastrophe that we're seeing around the harms of substances in Canada is unprecedented and catastrophic in that it is 4 times as bad as what we saw in the 90s. The life expectancy in Canada has stopped rising for the first time in 4 decades.
The impact of COVID-19 on people who use drugs has been immense. Many services have some closed and some reduced hours, so access to services has been more difficult. It's also disrupted the illegal drug market, so that has made a precarious drug market even more precarious and more dangerous with higher concentrations of fentanyl.
I've been a policeman for 24 years in Vancouver. I've spent my entire career, with a few exceptions, in drug enforcement, and I've never seen a crisis that is this bad.
On dénombre maintenant avec cette crise associée aux surdoses et aux drogues contaminées près de 14 000 personnes qui ont perdu la vie.
My brother Brandon was 18 years old. He was shot and stabbed in Abbotsfield. And at that time, I was actively using substances. It was a big eye-opener for me in regard to watching my parents then have to go through depression. It really made me value my life even more and make me want to do something to honor the life that my brother lost. So I'm one of the outreach workers, I'm not one of the nurses. I mean, we all have first aid. When I come into this role as an outreach worker, I also had to have an outlet to be able to speak up for injustices that were happening in the community.
We're doing it now because so many people are dying. We have to find a new approach. We believe that through bringing Canadians together in dialogue, that we will at the very least begin to understand each other's perspective a little bit more and work together towards better, longer-term solutions where everybody wins.
I have 2 siblings who are actively using, and so it really hits home for me that this isn't something that's an us versus them situation.
I think everyone could agree that the system is broken. Prohibition creates a highly toxic, illegal drug market with no quality control that delivers substances to Canadians of all ages.
On criminalise les personnes, on embourbe le système de justice, on crée de la violence, de la discrimination, de l'exclusion.
The police can't arrest our way out of this. It's taken a crisis to show that our treatment system doesn't work. It's taken a crisis to show that our drug policy doesn't work. It's taken a crisis to show that we need to change.
We're spending millions, billions of dollars on a failed policy. So that's what our citizens should be angry at.
The reality is we know that an 11-cent needle can prevent a case of HIV that might end up costing the healthcare system $1.3 million. Our morgue is full and let's rent a refrigerated truck to keep people. To me, that shouldn't be the plan.
It's unbelievable to us, even though we've been doing this for these years, that the deaths are still occurring. I lost my son Jordan in 2014. He died of an overdose. I'm back here in the advocacy world with this incredible frustration that the answers are there and we're not implementing them. First of all, we need to decriminalize people who possess and use illicit substances.
Put them all back in. We got a face breathing mask.
Cheyenne, what does an OD look like? The answer is like having these places, these safe places where people can come use within the community. You know, they got a better chance at not dying some awful death in a dark alleyway. You can't help someone once they're dead.
Why are we doing this now? This is a moment in history when it is apparent to so many people from so many sides of this issue that what we're doing isn't working.
COVID-19 has also exposed the inequities of our responses to these public health emergencies. On the one hand, there's been a magnificent response across Canada to the coronavirus. On the other hand, no government has been able to adequately respond to the overdose crisis.
Dialogue in every level of this endeavor is critical. If we don't talk to each other and listen to each other, I don't think there's any hope.
Tomorrow, for me, would be, providing safe supply to people that need it. Tomorrow, to me, would mean that nobody got arrested for being addicted to drugs.
We, as smart Canadians and reasonable people, could devise a system where people who develop addictions were not criminalized, were not marginalized.
And it's absolutely scary. I'm afraid for my community. You see somebody and you wonder, am I going to be able to have a conversation with that person the next day? Are they still going to be here? We don't have the ability here to waste any more time. The reality is that people are continuing to die, people are continuing to lose their lives, and there's not a reprieve in sight right now. No one's ideology should be more important than another person's life. We gotta have that free hug sign. Free hugs, the t-shirt that says free hugs.